And you are live.
Hey guys, it's Dr. Emer West Hollywood, and we're finishing up our patient's neck lipo procedure. One of the most important things to do after is tighten the skin externally. This is a device called Morpheus. This is internal radio frequency microneedling. Does hurt a little bit, but she's got a lot of numbing because we just did a little neck lipo procedure with the Renuvion J Plasma. You can see the beautiful contour of her neck. And we are just tightening now. This shouldn't really be uncomfortable to her. She's had numbing on, and she also has tumescent anesthesia in the neck area. But it's really important when you do these neck lipo procedures to do external tightening as well, so you get heating from the inside and out. We're also going to work on her texture at the same time for her melasma with a clear and brilliant laser called Permea. We're gonna do that. That's what I do on my skin. Almost there. You're doing great.
She is awake and she is good.
And you guys can see these are gold-plated needles. Now, one of the things I want you guys to know is I just launched Emerage Skin, and that's our new skincare line. High concentration, very clean, pure ingredients. I developed a couple products to be used post-laser, the Refit Face and Eye, which are the bioactive growth factors on purpose, so you could literally apply them right after doing a treatment like this and get quick improvement. Also, the Hyla B, which is our vitamin B, hyaluronic acid, and botanicals, that helps you plump and heal the skin very quickly. So definitely, after melasma treatments, you could use even vitamin C. So we have a lot of products in our Emerage Skin line that I designed specifically for my patients to use post-treatment. Look at that neck, you guys. Look at that jawline. It's amazing. And this is going to go into the skin, just get her so much more tightening. She just had her neck tightened with the Renuvion internal plasma, so here we are. I'm going to do an extra pass right under here. You're doing great.
Look at that. You can already see the contour right there.
You can already see the contour forming on the jawline. We're going to start now on the forehead a little bit, very light. She's doing so good. You guys can see fine pinpoint bleeding. Breathe. She's feeling a little.
It's called MORPHEUS8. Should definitely come in and see
So
us.
again, you see the needles.
Send your name, number, and email to the DMs.
We're almost there. She's feeling a little bit. I don't know if you could give her.
How do they get a consultation?
So if you guys want a consult, email us at appointments@jasonemermd.com or go to jasonemermd.com and fill out the forms, or you can DM us your name, email, and phone. Okay, you guys. Now, in office, this is a treatment you should do every 2 to 3 months at least, if not even more than that, to keep the skin really tight. You're doing great. You're doing great. Hold on. And this just literally tightens the skin. And it just needles underneath the surface.
Thank you, Ralph. We appreciate it.
And it helps her look younger, longer, because we're tightening. She's doing really good. She's basically done. We're almost there. And it's really important you can do this on the face, the neck, the jawline is where my girls notice it the most. I do this every 2 to 3 months to just keep my skin rejuvenated. No, it's okay. She's doing great, you guys. Sometimes you feel a little bit even under the sedation, even with numbing. But she's 3/4 done, so she's basically there. She's doing great. We're gonna get her through it. and we're gonna finish the treatment. But look at that jawline. Show them how amazing already. Almost.
Already improvement.
You could see the jawline immediately. And there's very minimal swelling. There we go, she's sleeping.
How deep do the needles go?
So these needles, depending on it can go 2, 3, or 4 millimeters. We're working between 2 and 3 millimeters right now. Hold on all of the face. You guys are doing great. And so literally we just follow this pattern. We tighten. You guys can see sometimes the muscles get hyperstimulated. It's okay. Not gonna hurt her. See? See the contractions? It's actually good. That means that they're going deep enough to tighten.
She is awake. Well, now she's not.
She's not gonna remember you guys, don't worry. We love her. We would never hurt anyone, but this is the treatment to do, and just so you guys know, it doesn't feel the best, it does hurt, but it's worth it. We're really following the jawline here to give more of a contour there. Usually I just go back, fill in the blanks. Any spots missed. Do a second pass over the jaw.
This is MORPHEUS8.
And this is MORPHEUS8 by InMode, probably one of the best microneedling radiofrequency devices out there. There's many competitors.
You can use this elsewhere, above the
You
knees.
can use this on the knees, the arms, other parts of the body like the buttock, crease. You guys can see, look, the idea here is a lot of pinpoint needles that are used to go into the skin, deliver energy underneath, and tighten it. We're going over where she had her neck lipo. I'll take this down for you guys just a little bit. We're going over where she had the neck lipo to get more tightening along the neck. All my women love this procedure. This is a minimal downtime, but we're doing it at the same time here just to make it easier for her.
You need more time?
Yeah, 5 more minutes.
Do you want to feather down below the chin?
We already did. We already did. You can't see it because of the lidocaine.
We already did.
We already did it, guys. Don't worry, she's in good hands.
How much does it cost?
Well, it depends. Everybody's different. It can cost you between $1,500 and $3,000 for this treatment. When we combine it with a laser or combine it with a lipo, it's a lot less. Okay, so that's perfect actually. We've pretty much filled in. It looks splotchy on the neck right now because there's lidocaine in here and epinephrine, so you don't see a lot of the redness there. So don't let it trick you. I've done this for many years, and now we're gonna go over to doing lasering, but this is exactly how Morpheus should look when it's done. So we call that MORPHEUS8 combined with the J Plasma. You guys will show you her neck, and we'll show you her healing over the next week. Okay, can you switch to clear CMD?